Welcome to Mental Health Training Module 10. Today, we will be exploring Attention Deficit Hyperactivity Disorder, otherwise known as ADHD. ADHD is a neurological disorder characterized by impulsivity, hyperactivity, and inattention that can affect our daily functioning. In the next few minutes, you will learn about its symptoms, its treatments, how to differentiate it from different similar diagnoses, and of course, ethical considerations. First, let's dive into the symptoms and diagnostic criteria of ADHD. ADHD is characterized by two main symptoms. Inattention, which is the inability to carefully complete a task without getting distracted, listening to others, things like that. And then hyperactivity impulsivity, which is having an unusually high level of excitement, which ultimately leads to not being able to use careful thought to complete actions. For a patient to be classified as having ADHD, they must demonstrate symptoms for at least 6 months, and the symptoms must have started before they were 12 years of age. In addition, the patient's inattention and hyperactivity impulsivity must interfere with their day-to-day life, such as their work life, their school life, or maybe even their social life. Let's take a quick look at how this criteria can be manifested in a patient.
This is Eddy, and he will be today's patient with ADHD.
Class, which part of the brain is responsible for rational thought?
It's frontal lobe, right? I think it's frontal lobe.
Right there,
Is
you
it?
just witnessed hyperactivity,
frontal lobe or not?
impulsivity. The patient, Eddy,
Teach.
blurted out an answer before the
Teach.
teacher even finished asking his
frontal lobe?
question. This is a perfect
Teach.
example of the high energy and spontaneity
teach.
common to hyperactivity impulsivity.
Is it
And as we
frontal
can
lobe?
see, it is interfering with functioning in the classroom. Now let's fast forward a little and see if he shows what inattention looks like.
Is it frontal lobe?
Class, let's go ahead and reflect on what we learned in today's lesson. Please take a few minutes to write down some of your thoughts in your notebook.
Pay attention to the patient now. Even though he was instructed to complete his individual classwork, he's zoning out and is not completing his work. This is a perfect example of the inattention characteristic of ADHD. Though we can't see it now, we can very well assume that this behavior will unfortunately continue at home also, leading to many misassignments and overdue deadlines. Now, let's flash forward to move on to the next segment. Now we're going to go over differential diagnosis. ADHD can be confused with many other disorders. One of these is sensory processing. ADHD can be confused with many other similar disorders. One of these is sensory processing disorder, or SPD. Now, how do we differentiate ADHD from SPD? Let's first discuss the two neurological disorders' shared symptoms. Both ADHD and SPD involve difficulty focusing, appearing restless, being easily distracted, and having trouble following directions or completing tasks. The main difference, however, and the most important takeaway from this section, is that ADHD is concerned with the regulation of attention, while SPD affects how the nervous system detects and processes sensory input. Because differentiating between the two is a difficult task, it's important to take a quick visit to a psychiatrist so you can get properly diagnosed. Once there, to identify whether the symptoms point to ADHD or SPD, the clinician will identify the primary cause of the behavior. For ADHD, the inattention and hyperactivity impulsivity occur across many settings and are not tied to a specific stimulus. The behaviors seen in patients with SPD, on the other hand, are triggered by an input of some kind, such as a specific noise, texture, or movement.
Hello, patient Eddy? Nurse. Whoa, what seems to be going on with you today?
I think I have ADHD.
Oh, that's okay. Here, lie down for a second. The good thing, Eddy, is that ADHD is treatable. One treatment widely recognized by psychiatrists like me around the globe, hold still while I check your vitals, is called dexmethylphenidate hydrochloride, commonly known as Focalin. Now, this stimulant medication increases dopamine and norepinephrine levels here in your brain, enhancing your focus and reducing restlessness. Now, this particular medication works very well with ADHD because increasing focus is the exact issue that we want to deal with when treating ADHD. Now, this medicine acts biologically, which in turn affects cognitive patterns here in the brain, ultimately affecting your behavior all throughout the body. Now, psychiatrists recommend using dexmethylphenidate hydrochloride. Hold on. Dexmethylphenidate hydrochloride because it's generally well tolerated for people of all ages, such as young adults like you, and has very few side effects with very minor inconveniences.
That sounds great. Thank you, dog.
Thanks, actually.
Hello?
Hey, dog.
Hey, how you doing?
Good. You?
Good to see you. You've grown so much.
Yeah.
So what's going on today? You have ADHD.
I think so.
Well, I believe you should start taking. I believe you should start taking Focalin. You should begin taking dexmethylphenidate hydrochloride, otherwise known as Focalin. It should help increase your focus and allow you to pay attention to more things.
Eddie, yo Eddie, you hear about Schedule 1, bro? Bro, a new game just came out, it's free. Eddie, bro. Eddie, bro, come on, let's get to work, bro.
Oh, Eddie, I'm not gonna ask again. Stop doing homework. Let's play games, bro.
Some games, bro. What are you even writing? Nothing. You're writing nothing. Could be playing Plants vs. Zombies, but you're gonna do this.
Now we're going to move on to ethical considerations. As we continue observing the patient's behavior in class, several ethical considerations guide how situations like these are handled. The patient's information remains confidential, and details about diagnosis or any medication should only be shared with the consent from the patient. Avoid stigma. The patient is not being shown as incapable and untreated per se before treatment or fixed afterward. The video shows how support can improve focus while the student's abilities remain untouched. Cultural considerations are also important. Families may have different perspectives on medication, treatment, mental health, school performance, and especially things to blame it on. Staying respectful through these different perspectives is important, as it ensures the decisions reflect the patient's health and values. If symptoms visibly interfere with learning, either through grades or behavior in class, educators should advise families towards counselors and psychologists for further qualified evaluation. Thank you for joining us.